Welcome to episode 6 of NeuroWomen Natter with me, Charlie Hart, also known as Awesome Charlie, and Toni Horn. And we will be talking this month about pregnancy and the effect it has on us. A trigger warning now, we will talk a little about miscarriage, and all of my pregnancies were before I even knew that I was autistic. So when I look back on them now, it's like I really could have done with that information. When I got pregnant with Iggy, I still felt like a kid myself. I think I was 26 or something. And I'd never really had any money. And I was quite new to even living with a partner, but he was a bit older than me. Martin, my first husband, I think he's 6 or 7 years older than me. And he was ready to settle down and get married and have kids. So whereas I think I would have spent longer working and maybe did some things like foreign holidays, bought a nice car, stuff like that, I never did any of that. I went straight from being skint to being pregnant with my first kid. And I wasn't pregnant for very long. And I know that sounds a bit weird, but I was actually 4 months pregnant before I even noticed. And he was a whole month early. The waters broke at 35 weeks. So I only knew I was pregnant for, 4 months tops. But it's not like I was getting off lightly because I had so many issues, like between being constantly drained at work, and I didn't know I was autistic, but I was having a lot of sensory meltdowns and panic attacks. I was really struggling to cope, and also I was trying to work full time and I couldn't even sit in a computer chair because my lower back and hips were constantly aching. I could barely walk, I could barely sit. So it was not a very nice experience. But then I was also incredibly anxious, maybe even depressed, because my husband at the same time had lost his job. So we'd moved to Northumberland, which is at least 4 hours drive away from any of my former friends and any of our family. And so I'd got no local support really. And then suddenly I was pregnant, and suddenly my husband's unemployed. And it was just such a difficult time in my life. So, but then at 35 weeks, my waters broke, which sent me into a complete tiz. I hadn't been to any of those antenatal classes because they were just about to start. I hadn't even handed over my work to the person that was going to be covering my maternity leave. We finished decorating the nursery and my waters broke. And I thought, oh my God, I'm going to have a really premature baby, maybe he won't survive. I'm even missing out the fact I had gestational diabetes, so I was in hospital like once a week, the whole afternoon, having checks that I was okay and having extra scans and things like that. But then, yeah, my waters broke and nothing prepared me for that. I completely went into shock, and they sent me to the local hospital, but then the local hospital in Hexham sent me away in an ambulance to Newcastle RVI, which is absolutely massive, really scary and really busy. And they sent my partner Martin home. So I actually ended up giving birth almost on my own. It's only when a midwife changed shifts at 8 a.m. and heard me scream, by which point the baby was like coming out. Yeah. And my husband was at home. So I ended up having him on my own, and 5 weeks premature isn't that big a deal, but I knew nothing about any of this stuff. I'd got no one to talk to. I'd done very little research, no antenatal classes, and suddenly this baby bursts into the world, and it's Iggy. So
I was actually talking to someone about this the other day because I've been doing some work in hospitals around neurodivergent pregnant women, right? And they asked me about my experience, and it'd be interested to hear yours, Charlie, of how it affected you in that environment, because those environments are not very comfortable. You're in a ward with lots of other women who are all in pain, or at the beginning of the labour, or nearly towards the end of the labour before they get moved into a room. And I myself found the experience just completely oversensitized, where I didn't know what I wanted to do. I didn't want to be there. I wanted to go home, but I knew I needed to be there. I was actually strapped down onto my bed because, same as you, Harry was early.
Were you free?
Early, and they had to monitor his heartbeat. So I was to lay on the bed because they had to monitor his heartbeat. So I couldn't go anywhere.
Right. Yeah.
And I just remember being so constantly stressed. And the same, they sent Dave home because they told me, they didn't believe me. They told me that I wasn't in labour.
Yeah. Yeah. So I'd got transferred in an ambulance from Hexham General, which was a midwife-led unit, to Newcastle RVI, which was huge and scary. Martin was with me at that point, but they put me on a fetal heart monitor and said, "You're not properly in labour yet, but the baby's okay." Gave me a steroid to mature his lungs because I was really panicking because I thought he was going to be like proper premature and might not even make it. And then, yeah, they just thought there was nothing really happening. So I was put on a ward with, they were mostly teenage girls who, like one of them wasn't eating properly. Another one was smoking and drinking and taking drugs all through her pregnancy. So it wasn't like a ward for people that were about to give birth. It was a ward full of pregnancies they were worried about, with girls that they didn't think were looking after themselves.
Yeah.
And they all wanted to borrow my phone. Like, I was the only one there with a mobile phone. So I shut myself in the bathroom, like literally locked myself in there so that they weren't talking to me, they weren't making small talk, and they weren't asking to borrow my phone.
It's just that sometimes there's no thought process. And like you say, I didn't know that I was autistic when I was pregnant. And again, it would have been really helpful because I would have been able to advocate for my needs.
Yeah.
So I'll tell you a bit about my story. So we was expecting Harry because I had IVF. So I had all that hormone treatment before the pregnancy. And we were very fortunate that we conceived Harry on the first IVF go, which is very unlikely. It's unheard of, and we were very fortunate. But again, people, when you say IVF, the expectation that it's always the woman, but it actually wasn't me. It was Dave. So we had to obviously do some thing around, make that happen. So I remember that my pregnancy itself was absolutely fine, but it was too good. I didn't get no morning sickness. I was actually half the time worried that I wasn't pregnant because I wasn't getting any pregnancy symptoms. And Harry hardly ever moved. And the only time I knew he was okay is because at 3 o'clock every day he'd get the hiccups. Right, so I knew I'd get to 3 o'clock. If I felt hiccups, I knew he was okay. But I was working full time in banking at the time. We were going through a bit of a really stressful restructure. Now, I don't know if that brought on the pregnancy or not, but I was the same as you. 5 weeks early, I hadn't handed over my clients. I haven't handed over my portfolio. I hadn't done any. I didn't even do any of that. And we went out for dinner. And when we got back, I said, "Dave, my waters are broke." And he said, "Don't be silly." I said, "My waters are broke." So it was the middle of the night. I think it was about 11 o'clock at night. And he took me, because we live in Essex, this is Chelmsford Hospital. Took me to Chelmsford Hospital for the midwife to come in and tell me that I wasn't in labour. And I was like, because the contraction monitor wasn't monitoring my contractions. And I said, "Well, look, I can absolutely feel that I am having contractions." So like I said, they strapped me to this bed to monitor Harry's heartbeat. And they sent Dave home and said, "Look, there's no point. She's going to be here for a while. Go home." And then exactly the same as you, there was a crossover where the lady at 8 o'clock, so you're thinking, I went in at 11 o'clock at night. Now, this is now 8 o'clock in the morning. It came over to be examined. And she said, "How long have you been like this?" And I said, "I've lost complete knowledge of time at the moment." And she said, "You're just about to go into labour. You're just about to
delivery." Yeah.
So then they ring Dave, and I'm lucky enough that Dave was only 20 minutes away. So I get carted off, and I was like, "Why was no one listening to me?" She's like, "You're 5 centimetres dilated." And I was like, "No, 10 centimetres dilated, sorry." And I was like, "Why was nobody listening to me?" And I didn't have any drugs. All I had was gas and air. So I think it worked out. I was in labour with him for 17 hours. But when I had him, he was really, really small, Charlie. He was 4 feet and he wouldn't feed. So they took him away from me. And I was already so anxious and overwhelmed with it all that they took him away to a ward. So the ICU was upstairs on a different ward. So I'm having to go there, just giving birth, because I didn't want to leave him on his own. And I was up and down, up and down. And we were in for a week because his sugar levels were low and he needed tube feeding because he wasn't feeding. And in the end, he was okay to go, but they wouldn't check me out because everything was swollen, my legs were swollen, my blood pressure was really high. And I said, "My blood pressure's high because my child has been on ICU for the last week and I'm up and down and I'm not eating properly. I'm just worried about him constantly. And I actually discharged myself against what they said. I was like, no, because I know full well I'm like this because I'm in this situation. I'm in this hospital. I can guarantee you that my blood pressure will come down once I'm home.
Good for you. Yeah. So I had similar, but they didn't take him away. But he was Iggy was 5 pound 11, I think. So he was a relatively healthy weight. They weren't worried about his weight, but he wouldn't feed. So because I'd said on my birth plan I wanted to breastfeed, and that was the idea, they were really, really insistent that I kept trying to do that. So what actually happened is that every 3 hours, morning and night, for 2 weeks, I was having to try to breastfeed this baby who'd been born at 35 weeks. So that's before the rooting and sucking instinct is properly established. So every 3 hours I was woken up if it was nighttime, and I was putting him to the breast, and he was biting and scratching and pulling away and not wanting to feed. And between those hours I was trying to express breast milk, and my own body didn't know what was going on. I certainly didn't know what was going on in my body. So it was just like a pitiful little stream of milk. But they transferred me back from Newcastle to the midwife-led unit in Hexham, which was like a private room, so that was great. But they really, really wanted me to breastfeed. So my first husband, Martin, Iggy's dad, he was coming to see me every day. Sometimes he'd get them to look after the baby so we could go out for lunch or something. He was there for me every day. But I kept saying to him, I really want to go home. I'm really depressed. Yeah. And he kept saying, we need to do what's best for Iggy, and we need to listen to the staff. They know what they're doing. They know what they're talking about. And I think it was day 13 when I finally said, absolutely fuck this. I feel like a prisoner.
Yeah.
And like I'd gone to get some tiny amount of express breast milk from a fridge in the neonatal care unit, and I couldn't get in because they were telling some other parents that their baby had tragically died. And I was just standing there thinking, I don't know how to deal with this, and I absolutely want to go. I would have just like walked out of there on my own and just walked, but Martin came over and we bought a sterilizing kit and bottles and formula and all the other baby stuff that we wanted, because we didn't have any of that shit. All we had is my hospital bag, and that was it. And we went home. But they didn't want to just discharge me, and I'd been there for 13 days. And yeah, I still tried. When we got home, I still tried him on the breast. And by the middle of the first night, that was out of the window, and he was happily bottle feeding, which meant Martin and I could share the burden.
Yeah, no, with Harry, he was bottle fed, obviously, because he was tube fed from the very day dot.
Yeah.
And you know what? I said to somebody, I was having the same conversation that they say breast is best, right? And they push it. So Louis was breastfed because he came out. He was only 2 weeks early. He was a good size. He was. I mean, he still eats like a monster now. I mean, the boy doesn't stop eating. But Harry's always been different. But Harry was bottle fed and Louis was breastfed, and they say it's because it's good for their immunity. But actually, Louis was a really sicky baby, and Harry wasn't at all. So I'm like, well, that theory just completely goes out the window. They try to push it so much, and they try to make you feel guilty about it. Well, I was in the circumstances where my child wouldn't get fed unless I bottle fed him.
I could have done with Iggy breastfeeding, because as it turns out, he was allergic to cow's milk protein, which is quite common in autistic families. Actually, my brother was as well, and I'm a bit cow's milk intolerant too. But he was constantly throwing up and covered in eczema. But what happened, I mean, I wasn't going to talk a lot about parenthood, but this is part of my neonatal experience. I felt like I wasn't prepared for looking after a baby, and I was completely isolated and nobody really understood. But every time I went to the baby clinic to get Iggy weighed, always be looking at the growth charts, his weight would be sliding down. And they would say things to me like, your baby is failing to thrive. And all I heard is the implication that I should have been breastfeeding and that it was all my fault. It took me 6 months, I believe, before I thought, do you know what, maybe he's cow's milk intolerant like my brother is. And I said to them, you need to prescribe some soya formula or something. And they were saying, no, we're not going to make that assumption, because, you know, he's not wasting away, he's gaining weight just slowly. the reason he was gaining weight is because he was puking it all up, and then I was refeeding him, and eventually some of it was staying down. But I switched him to formula. I said to them, look, you can prescribe it or I'm just going to buy it. And I bought some soya formula, switched him, his eczema cleared up. He was hardly puking at all. And I thought, oh, great. So actually, mum does know best sometimes.
Don't always do. It really annoys me. This is sort of talking about, postpartum. I had two completely different experiences. Now, no one ever spoke to me about postnatal anxiety.
No.
I didn't even know postnatal anxiety existed. I knew about postnatal depression, but I didn't know about postnatal anxiety. And actually, it nearly ruined a lot of my relationships. It nearly ruined the relationship between me and Dave. It nearly ruined the relationship between me and family, where I was utterly obsessed of having Harry in my sight 24/7. I couldn't do nothing. I couldn't go anywhere. I remember leaving him with my mum because I was like, well, you've got to go out for dinner with Dave. It's your anniversary, go for dinner. And I was on the phone to my mum every 5 minutes, and Dave was like, what's the point of being here? You're constantly on the phone. And I always had this catastrophic thinking that something was going to happen to him if I wasn't there, if I wasn't protected. And it's horrible as it sounds, I didn't even like leaving him with Dave. I mean, that's his dad. Dave's a brilliant dad, and I didn't even want to leave him. And I was like this, and the thought of going back to work scared me so much, and I actually left it to the maximum for 12 months. And I remember putting him into nursery for the first time, and I literally down, I couldn't do anything. I was at work and I couldn't even work because my brain was constantly, is he okay? What's he doing? Is he all right? And eventually it did get better over time, where I had to leave him because I had to go back to work. But no one ever said to me, I remember a family, and my dad would do something, I'd be like, oh, don't do that. And my dad would like, stop it. Why are you reacting like that? And it was constant overreaction all the time. And I felt like I just couldn't do anything without, I needed to be there to protect this little human being, and, making sure that people didn't pick him up the wrong way. And it broke down relationships. But then with Louis, I had postnatal depression because he was constantly sick. He was colic, and he was also had reflux, and he had cow milk intolerance, right? So he was constantly being sick on me. He constantly wanted feeding. He constantly was crying 24/7. And I just remember being so miserable, thinking I should be really enjoying this like I did with Harry.
That's what I was like with Iggy.
Really miserable, and I don't understand why I'm miserable.
I never thought about it as being depression at the time, though, because
no, I didn't.
I'd got this idea. I knew what depression was, but I'd got this idea in my head that depression is an irrational mental response rather than a completely justifiable and understandable one. So I felt sorry for myself because I was stuck with this constantly puking and screaming baby that I struggled to bond with, that was covered in eczema, was clearly unhappy, at times to the extent where I couldn't settle him, and I was standing out in the street. It was a private road, so people would only drive down there if they lived there and they're parking their cars there. But I'd be standing there holding him out in front of me while he cried until some neighbour came out to help me soothe him. And I just felt like a failure as a mother, and all the other aspects of me as a person kind of fell away. So I was just this failed mum and nothing else. But I didn't think that was postnatal depression. It sounds ridiculous when I try and explain it now. And I was obviously very, very let down by the health visitors and everyone else who saw what was going on, and they saw how I was and how Iggy was, and they just wanted me to feed him more. And I was not coping at all, but thinking, do you know what? This is not in my head. This is all real. So it isn't depression. I don't need antidepressants.
It comes back to that as well. Like Dave used to say to me, I don't know how they missing that you're not suffering with X, Y, Z. And I said, because now I know, looking back, I'm a high masculine individual. So when they come around, everything's fine.
Yeah,
everything's perfectly fine, and I'm high masking, and I'm behaving the way that a mother should when they come around. And it's not that Harry. The only fear of Harry was that the fact that I would never let anyone touch him. Right? So he was constantly on me and with me. But with Louis, I always felt like no one was helping me. Dave's not helping me enough, and I felt like I was failing Harry because I was always with Louis, and I always felt like this failure for both of them. But then I was saying to you earlier, in between them, so Harry and Louis are both IVF conceived, both on the first try, which, you know, I'm very, very grateful for, and I know that's a high privilege for some. But in between that, I had a pregnancy, which I said to David, Harry must have been about 6 months old. And I said, I'm pregnant. He said, no, you're not. I said, I am, I'm pregnant. And I took a pregnancy test, and I went to go and see the midwife. I had a male midwife, actually, in my local doctors. He was there through Harry. So, he was always really good. And then I went back 2 weeks later and I said, something's not right. There's something not right. And I knew instantly that something wasn't right. And he was about to go on holiday, and he said, oh, you'll be all right, you'll be fine, you know, I'll see you in 2 weeks' time. And I said to Dave, I need to go for a scan, we're going to have to pay for a private scan because I know something's not right. So I did. I had to pay £150 for a private scan to find out that I had an ectopic pregnancy, to then be sent to A&E, to sit in A&E for 6 hours to find out, to tell me what I already knew because I'd paid for a private scan. And then they sent me down to the ultrasound ward with all these other pregnant women. And I remember sitting there because I don't think it clicked quite as much at this point that I had to lose the baby because the baby was ectopic. And I remember that, and I asked if I could go. I said, I don't want to be here. I don't want to sit here. And they said, no, you've got to wait. And I'd just come out of the scan, and they had me in a wheelchair, and I said, look, can I just walk back? No. It's policy, it's insurance. We have to get somebody to come and get you. They left me there for 2 hours to watch all these pregnant women come up with their scan pictures and everything else. And in that moment, because I don't cry a lot, Charlie, I'm not a crier, right? And even Dave said, you've got a heart of steel, you have. And I was like, no, I haven't. It's just I've never had that physical motion to cry. And I broke down crying, and it hit me that, that it shouldn't have been that way.
I've been through similar, slightly different circumstances, but yeah, it was the cold clinical way that it was dealt with and the lack of compassion that really affected me. So after I had Iggy, and we stayed in Newcastle for a couple of years, but then he was so sickly all the time that we moved to the Midlands nearer to family, and then we started trying for Izzy. I always wanted an Izzy. That's why Iggy was called Iggy. It isn't his real name, but it was the closest to Izzy that we could think of for a male baby when we found out it was a boy. But we tried for Izzy, and I got pregnant about 3 years after Iggy was born. Same time that Martin's sister was expecting a baby. So I'd got images of us being on maternity leave together, doing stuff together. Very different from how isolated I was when I was in Northumberland and pregnant with Iggy. But I didn't really get many pregnancy symptoms. And then I went for a 12-week scan, and I was told that the heartbeat was fading in and out. So they didn't kind of talk about the implications of that. I was just left guessing. But they sent us then to a different hospital in the next town over to have another scan for a second opinion. And that scan showed no heartbeat, which they explained to me just like that, and without really explaining the implication. I know it's sounding obvious by this point what the implications are.
But you're wrong.
They also said that the baby only measured 9 weeks, and I was meant to be 12 weeks, and it had been about 3 weeks that I'd been feeling fine and going to work. And I even went to I think it was my dad's 60th birthday party or something, and I was driving and we were out till 1 o'clock in the morning. People were saying, aren't you tired? You're pregnant. I looked pregnant. I still had big boobs, but I felt normal. And so this is the worst. So you really want a trigger warning for this. So this is just fucking awful. But I was sent back to the first hospital for another ultrasound in the X-ray department, which was full of, like you said, other pregnant women and young kids and stuff. And they confirmed and told me that I needed to go. They didn't say to me then, you're going to have to abort this dead baby or anything like that. They said that I had to go back to the maternity ward to run through my options. So running through my options was a sister saying to me, you can either go home and wait for nature to take its course. You can take a tablet that will speed things along and go home and wait for nature to take its course. or you can go to theatre and we'll get you in for, and now this really, really bugs me, this phrase, an evacuation of retained products of conception. They don't say, so we can suck out what's left of your baby and your placenta. They call it an evacuation of retained products of conception. And that is the most heartless and clinical thing I've ever heard.
Horrible.
So I went home and that's when I started to bleed. So I went back to hospital and passed blood clots all through A&E. And the whole thing, it wasn't just that I lost a baby that I desperately wanted. It wasn't just a bereavement. It wasn't just loss. It was a trauma that I locked up for 10 years. So it was horrific. And I talked it through with a psychodynamic therapist 10 years later, but it had been bottled up for 10 years in a box marked "don't touch" under any circumstances. Yeah. So I'd be like getting psychologically triggered during watching a program where, say, someone goes into premature labor or something, or it's any kind of thing like that. I'd just get a trigger, but I didn't know I had PTSD. So, and then 3 months later, I got pregnant again. And that time we paid for a private scan at 7 weeks, and the heartbeat was already fading in and out, and the exact same thing happened again. So we ended up with a 5-year age gap between Iggy and Izzy. And in that pregnancy, I had gestational diabetes and I was insulin dependent. Again, gave birth without anyone there with me because they sent Martin home again, saying nothing was happening. So, and that time the cord was wrapped up around her neck, so she came out blue, and I thought she was going to die. But I've got this picture where they'd cut the cord and she starts crying and breathing, and I'd actually vomit. I shake and vomit because it's like it was just a shock. But she was fine anyway. She was fine.
Childbirth is so traumatic. It really is. I mean, I was induced with Louis because Harry was so small and premature. They induced me because Louis stopped growing. He got to a certain, he was growing really rapidly. Then he got to a certain weight. He was 6'4" when he was born. And they said, we've got to induce you 2 weeks early. And I mean, that was horrendous in itself. I mean, they give you this injection, or they do this thing. I can't remember it exactly what they did. And then you're just left to go, oh, and then it's just instant pain, like more pain than I was in with 17 hours being in labour with Harry. I was like, I've never felt anything like it. I mean, labour's hard as it is, but that pain was horrendous. And I remember Louis, because I had already had a child, Louis wouldn't stop crying after he'd been fed. And I was like, he won't settle. Where Harry didn't cry at all. So it was completely different experience. And so she said, have you tried swaddling him? And I said, what's swaddling? She looked at me like to say, haven't you already got a child? But I never had to swaddle Harry. So then she swaddled him and he stopped crying. And then again, I was made to feel stupid or ridiculous. And I think a lot more needs to be done in the NHS around understanding, especially those of us who are neurodivergent, how things can be done differently. I mean, it's for every woman anyway. For every woman needs empathy and be sympathetic, and anything that, you know, there is mountains of women out there who are not neurodivergent, have had really bad experiences with pregnancy and aftercare as well. But I do think then more needs to be done to understand the implications mentally as well as physically for us that kind of can't cope a little bit more than others in those situations.
Yeah. Obviously, I didn't know I was autistic.
No, I didn't.
But I did know that I wasn't responding to it in the same way as whatever idea of typical I'd got from whatever other mothers I knew or whatever programs I'd seen, I don't know. But I didn't respond in a typical way. And that's why I was left to labour alone. And it's why no one realised how much I was struggling and that I almost certainly needed antidepressants. Now, I didn't need it with Izzy, I had postnatal euphoria, and it's quite bizarre, but that's quite difficult to handle as well, because it meant I didn't get any sleep at all. I was just constantly excited. Jay is my third baby, my fifth pregnancy. She's with Si, so my second husband, my current husband. We decided to have a baby together, and that was amazing. I didn't get gestational diabetes with her, so it's kind of bizarre. I really expected it, and I spent every Monday afternoon being checked out in the antenatal clinic, but I never developed the gestational diabetes, but they still induced 2 weeks early. So I've been through that whole thing as well. They tried to send Si home, and he told them absolutely not, in no uncertain terms. And they said, well, you can't stay, sir. This is an all-female ward. And he said, well, you're going to have to find us a private room then, aren't you? Because I'm not fucking going anywhere. Yeah.
It was quite comical, because when I was being induced, his dad was on another ward, and he had sepsis, but he was all right. He just, when Dave was visiting him, he'd just come out, he'd had all the antibiotics. So Dave went, I ain't going anywhere. I'm just going to go to the ward to like one shift down. I'm going to go and see my dad. And Dave was like, just ring me when I can come back in. He said, I'm not going home. He said, I'm just going to go and pop in and see the old man, see if he's all right. So that was quite funny, because he even says, now I always remember the day that Louis was born, because I was in hospital with sepsis. I'm like, yeah, all right.
Yeah.
Oh. Well, I think that's enough trauma for one day, don't you?
Yeah. This is a right barrel of laughs, isn't it?
But that's apart from all the trauma and everything else, even though they both have their moments where they're a pain in the backside, they're great.
Yeah.
I love them to bits. But
I don't want kids. No. I never wanted kids. No, I absolutely love my kids.
Yeah.
They're my pride and joy.
And mine.
And I don't love them despite them being autistic and queer. I love them because they're so autistic and queer.
Love that. Let's celebrate that. Love that. Yeah. I would say we probably both of us have got eventful houses.
Yeah, definitely. Yeah.
Never a quiet moment, eh, Charlie?
No, this is why I can't work full time. There's just so much going on.
Oh, brilliant. Well, I think that's enough for everyone to talk about, don't you?
Yeah. There's loads more. I'll have to put it in the book.
Much more.
It's a really common experience, I think, to not pick up the signs that you're pregnant, not pick up the signs you're losing a baby, to not realise you're in the later stages of labour and you're about to deliver. And this is something that I really think that the medical profession needs to listen to more of.
Yeah, and I think as well they need to look at more of supporting anxiety, post-anxiety, where it's that fear of you not being able to leave that child, because I understand that depression is obviously higher because there is cases where people choose to take their lives with postnatal depression, but actually there should be support in place for postnatal anxiety as well, because it causes marriage breakups, it causes broken relationships, because that person, God knows what he's done to Harry for the fact that I wouldn't let him go anywhere else. And for a while when he was younger, he wouldn't go to anyone else, because that was my fault. That was my doing. He wouldn't leave me. When I wanted him to leave me, he wouldn't, because I created that. So,
yeah, I think we could really help if hospitals want to get us in as consultants to work out how to support us better. It's still shit what I've been through, but I've done the therapy, I've processed it, and I'd be really keen to help other women not to have to experience similar.
100%. Brilliant. Well, that's it for episode. Is we episode 6 or episode 5?
6? Yeah, that was episode 6.
Wow, Charlie, we've been doing this for 6 months.
Yeah.
That's amazing. Well, thank you everyone for either watching or listening. Make sure to subscribe to both our YouTube channels or listen to us on Spotify.
Thank you.
Bye.